Breaking news now on CBSN New York, a news conference at Bellevue Hospital. Mayor de Blasio beginning to give us the latest update on the coronavirus outbreak. And right now, talking to staff members at Bellevue, who, as he came in, he gave bumps to say hello, obviously did not shake hands. We cannot forget all the healthcare workers who are getting everybody through this. So let's listen to Mayor de Blasio as he updates us. The last number we had of the 173 cases of coronavirus in New York State, 36 of those people are in New York City. Let's listen in right now.
Also, this group is exceptionally good at the elbow bump. I think you guys can go out and teach all of New York City how to do that. I want to start up on our update today. We've got some new information. But I want to say something really clear to all New Yorkers. Every single day we're going to give you new information. Every single day we're going to give you what we have that we can tell you that's clear and helpful. But every single day we're going to tell you we're also receiving a lot of new information from our own experiences here in the city, from national sources, international sources, and every day we're trying to understand the exact right approach to take. The information changes day to day. We get new interpretations all the time. We get new strategies all the time. We're going to constantly update people, but you should assume a changing dynamic. This, we've dealt with a lot of things, but I think we can all say with coronavirus, we have rarely seen a situation that started with people not even understanding the disease to begin with because it was brand new. That's been the whole international community, medical community. And then we've all had to learn by doing. And our understanding of the best approaches keeps evolving. So you will hear change because the information is changing. But we are still in the middle of a fight right now. We have to every single day do the best we can with the information we have and the resources we have. So we'll tell you what we're doing, why we're doing it, and then as information changes, we'll provide those updates. The fact is, everything is inherently preliminary at this point because, again, the information about the disease continues to evolve. It helps us to have our own experience here in New York City, our own work from our Department of Health and Hospitals, our disease detectives giving us new information all the time. But there's a lot more out there that we are trying to glean and work with. The crucial point I made yesterday, and I'll keep saying it, New Yorkers are going to be able to have a really big impact on this crisis by your own actions. So the government is here to protect you, protect your health. We're going to do everything we know how to do. We're going to throw in every resource we got. But this one is participatory. This one is for everybody to be a part of the solution. The government cannot solve this alone. It has to be in every family, on every block, in every workplace. Everyone has to participate, from those basic things, washing your hands, hand sanitizer, covering your mouth when you cough or sneeze, onto the kinds of decisions we make in our life. Starting with being very sensitive to the vulnerable people. We have seen this over and over again. It's very consistent all over the world. People over 50 with the pre-existing conditions, that's the #1 problem. If there are people like that in your life, support them. Be really careful, watch out for them. We need New Yorkers to watch out for their fellow New Yorkers, which New Yorkers are very, very good about. But if someone in your life is vulnerable, be careful. For the great example I'm giving, and I think it's a real life example, grandparents who want to visit their grandchildren. We all understand that. That's normally fantastic. But if a grandchild is sick, the grandparent should not be visiting with them now. If the grandparent wants to visit their son or daughter, but the son or daughter is sick, this is not the right time for that. So we really want to be clear about those common sense measures. The folks who are vulnerable need to take precautions. We need to support them as they take those precautions. Talked about employers being as flexible as possible, where you can have some telecommuting. We like that, we need that. Where you can't, we understand. Where you can stagger work hours, that helps. Everybody can participate. Literally every single person can be part of ending this crisis. So we'll keep giving information, and we'll keep updating people every step of the way. Now, folks want information, they want accurate information. Want to remind you can go on our website, nyc.gov/coronavirus, nyc.gov/coronavirus, and you can text COVID, COVID, to 692-692. That's COVID to 692-692. I think it was yesterday we said 20,000 people have done that. Now 60,000 people have done that. It's a really good way to keep informed. We're going to give a quick presentation, then you'll hear from, I'll give a presentation, you'll hear from the CEO of our health and hospitals, Dr. Mitch Katz. You'll hear from the Speaker of the City Council, Corey Johnson. Want to thank for their partnership and the good work they're doing. Borough President of Manhattan, Gail Brewer, thank you very much. Councilmember Steve Levin of Brooklyn, thank you very much for all you're doing working with us. Let's give them a round of applause and thank them. Okay, so as we said, we're now in what we are simply calling phase 2, and that means more and more guidance to New Yorkers of things that we want you to adjust in your life. I gave the example of employers staggering work hours and allowing telecommuting where they can. Again, those who are self-employed, those who have the ability to make those decisions yourself, we want you trying to, if you're going to have to use subways, use it on off hours to the maximum extent possible, avoid the rush hour. If you can telecommute yourself, we prefer that right now. We need people to be mindful. We have a real concern about the super packed subway cars, particularly in rush hour. If you don't need to be on one of those, please avoid them. Even if it means letting a few trains pass until one's less crowded. And then there's the really basic but very, very important things. You know, a lot of people get sick and they power through it. I got a show of hands, even these healthcare providers. You ever been sick and powered through it? Raise your hand. Raise your hand. Okay. Stop doing that. So what we need to do, all of us, is if we're sick, we need to take it seriously. We need to talk to our doctor. We need to stay home if we're sick. Healthcare workers, obviously we depend on you, so the best way is for the healthcare, and Mitch will speak to this, healthcare workers sick, they get to be evaluated by healthcare professionals, and if they shouldn't be at work, they shouldn't be at work. If they can be, that's great, or with whatever precautions. I want you to go in detail about that. But for the rest of everybody else, if you've got those cold and flu symptoms, don't go to work. Consult with your doctor, make sure you're well before you get in the presence of lots of other people, and God forbid, do not go near someone in that vulnerable group over 50 with the pre-existing conditions. Okay. I'm going to state it just so we're consistent. Over 50 pre-existing conditions, that means heart disease, lung disease, cancer, diabetes, and a weakened immune system. Those 5 areas, we've also said not a condition, but a factor. Smoking and vaping do not help. In fact, they make it harder for someone to handle coronavirus. For folks who have the pre-existing conditions and are over 50, be very, very mindful of who you're coming in contact with. We want you to adjust your routines mindfully. And if you do have symptoms, that group of people needs to get to care immediately. Okay. Now, update on numbers. We have a very rapidly evolving situation on the numbers of cases. And we're obviously concerned when we see more cases, but there's a piece of this that actually is, in its own way, good news, which is the testing capacity is coming online more and more. We still are waiting for that formal confirmation from the FDA that we've been talking about. We're hopeful, but we still want it to be 110% formal. We haven't gotten that yet. But the private labs that started up on Friday are now really ramping up, so we are starting to get more and more test results back. They're coming in so intensely now that being able to give you the detailed case breakdown, we're not in that position to do that at this moment because so many new cases are coming forward. We will, of course, when we can, give you updates on particularly pertinent cases. And again, what we have been doing historically, there was a good question yesterday. I want to just clear this up for all the cases we've given you up to date, the ones with detailed profiles. were all New York City residents, but one exception, the original lawyer from Westchester County. And the reason he was counted among the city cases was he was diagnosed and hospitalized in New York City and remains in New York City. That was the one aberration. But now, with the private lab results coming in very, very rapidly, we're adjusting our approach because we don't get the profiles on each case as quickly as we were because of the sheer numbers. So again, we won't be giving across the board individual profiles. We will be giving them in particular cases. And we are happy to be getting more and more test results because it allows us, again, to ensure that people are getting the care they need, people are isolated, need to be isolated, and folks who are negative can go on with their life. As of 12 noon, so I gave a report yesterday, and then this morning we had a different report. Now we have another update as of 12 noon, working with the state of New York. The number now for confirmed cases in New York City is now 36. 36, that is 16 new since yesterday, and 11 new even since this morning at 7 a.m. when I last spoke about this. I said yesterday we're going to start to talk to you about people who have their cases resolved. The first two that we will get information on, but they are not yet fully through the process, are the two healthcare workers who have been in Iran. They are now asymptomatic. They're going through a first of two tests that will lead to them coming out of quarantine. We're waiting for the results soon on the first test, and they'll take a second in short order thereafter. If both those come back negative, they will be out of quarantine, hopefully as early as the end of this week. So those are the first two that we will report on. As other people come out, we're going to give you those updates. Now, as of, I want everyone to hear carefully, this is a different time frame because this is the last information we have as of 10 a.m. before some of the newer information came in on cases. So this is probably dated by now, for sure, actually is dated by now, but at least it's somewhat helpful information. As of 10 a.m., the number of negative cases for New York City was 258. That was 57 new since yesterday. The number of pending tests, 195. So now what you're seeing is we're talking about, this is what we've been projecting, we'll be doing hundreds of tests a day. And that's where the numbers are getting moving so rapidly that we won't be able to do the individual cases the same way, again, with some exceptions. In mandatory quarantine, 30 people right now. In voluntary isolation, 1,980. So this is a context of community spread, which has only been with us since the latter part of last week, and intensive testing, which has really only been with us the last few days. Now we're going to see a very different trajectory in terms of the information flow and the numbers, and we're going to keep giving updates every day. Okay, a few quick updates in terms of the city. An issue that has been getting a lot of attention, rightfully so, around the country, around the world, is cruise ships. So the cruise ship terminals in Red Hook and the west side of Manhattan, those are licensed via the Economic Development Corporation. They are run by a private entity called NY Cruise. We are following the guidance of the CDC and saying to all New Yorkers, this is not the time to take a cruise. So I just want to start with that. Obviously, the cruise ships have been a real focal point for problems. While our nation gets ahead of this crisis, this is not a great time to take a cruise. But if people do choose to take a cruise, specific actions are being taken. All the two terminals are being thoroughly cleaned throughout. And healthcare workers will be on site if anyone is leaving on a cruise for additional screening during boarding. anyone who attempts to get on a cruise and has a temperature of over 100.4 will not be allowed on a cruise ship. So that's outgoing, and that's trying to guide our fellow New Yorkers on how to handle this situation and protecting all the fellow passengers. The obvious other question is the incoming. And on the outgoing, I don't have in front of me, but I'm going to turn to my team and say we should check with EDC on the outgoing cruises. We have the incoming. Let's get the outgoing dates. For incoming cruises, the next incoming cruise to the Manhattan Terminal West Side will be Sunday, March 15th. That cruise will be met by Department of Health officials, and the same standard of 100.4 degrees will be implemented in this case, meaning folks who are coming off that cruise with that temperature will either, if they're from New York City, depending on their overall health, they either will be allowed to go home into self-isolation or will be taken to a hospital depending on their health. If they are not from New York City, they'll be taken to a hospital or other healthcare facility right away. That's Sunday, March 15th. It's coming Sunday. The next incoming cruise to the Red Hook Terminal in Brooklyn is April 9th. So we won't be seeing much there anytime soon. On the issues related to the federal government, I mentioned that we still are waiting for the formal approval on the automated testing. Again, we keep seeing promising signs and some movement, but we do not have the fully confirmed formal approval. We need that right away. We've also talked about the N95 masks, which are particularly important for keeping our healthcare workers and our first responders safe. We definitely need more of these masks. The state, to their great credit, has kept a reserve. They gave us 120,000 new N95 masks. That's crucial. I want to thank the state for doing that. But we will certainly need more, and we'll need them soon. We're sending a specific request today to the U.S. Department of Health and Human Services for 300,000 more N95 masks, specifically for our health and hospitals personnel who need them and for our first responders. That supply, in addition to the 120,000 from the state, the 300,000 more we're requesting from the federal government, if we could get that soon, that will take us through the coming months. Related to our disease detectives, we are working right now to double the number of disease detectives. One element of that will be training all school nurses to do this work, to do the initial screening. We'll have an update shortly on the exact timeline on the doubling and the protocols we'll use going forward. But one of the most immediate things we'll do is get all of these very effective school nurses into this work immediately. That's going to help us speed up the process. Important note for all New Yorkers, obviously there's information out there about coronavirus, and there's misinformation and there's confusion. One area that should be crystal clear is that it is absolutely crucial for everyone to keep giving blood. There is no danger in giving blood, but we must maintain our supply. At this moment, our supply is okay, but we're concerned. We have seen some workplace blood drives canceled. That is a worrisome sign. So we will be working to make sure that those, as many as possible, blood drives continue. We're encouraging all New Yorkers who can to give blood. I'll be doing that myself in the coming days. And a thank you to all New Yorkers who have been giving blood and everyone who works to keep our supply strong. But there is no health risk related to coronavirus in the process of giving blood. One more update. Yesterday, we talked about, later in the day, an emergency medical technician who works for the fire department tested positive for coronavirus. The information we have at this moment is that that was passed along by a flight attendant who is this individual's girlfriend, who had been traveling to an affected area. As a result of this diagnosis, 5 fellow EMTs are in self-quarantine. They are all asymptomatic. The EMT in the time span that's pertinent here treated 11 patients, but when treating these patients wore protective gear. The Department of Health and the FDNY will be reaching these patients today to follow up and do the normal diagnostic work. But the good news is they are identified, and the other good news is that the EMT wore protective gear, but we're still going to treat each case, obviously, very seriously. Okay, just a very few sentences in Spanish. Continuamos tomando nuevas medidas para detener la propagación del coronavirus. Necesitamos más ayuda del gobierno federal para proteger a nuestros trabajadores de la salud. Quiero agradecer a los neoyorquinos por sus esfuerzos para acatar nuestros consejos. And that is a thank you to all New Yorkers who really have been following the guidance in so many ways and helping us to address the situation here in New York City. Now to talk about the capacity of our health and hospitals, facilities, and all the personnel, like these good people here, who will be part of fighting off this virus here in this city. I want to turn to CEO of Health and Hospitals, Dr. Mitch Katz.
Thank you, Mr. Mayor, and thank you for having this at Bellevue. Bellevue is the longest-running public hospital in the United States, established prior to the signing of the Declaration of Independence. Bellevue was a leader in the HIV/AIDS epidemic. Bellevue was there to provide care with compassion, without fear, to provide the very best of care. Also in the Ebola outbreak, this hospital was the only hospital in New York State to successfully take care of somebody with Ebola who fully recovered, and to do that without any other infections occurring to healthcare personnel. This is a hospital that knows how, and knows how to do it with compassion, with love, with competence. It's also a public hospital, which means that people who are undocumented, people without insurance, they know that they can come here, they can come to Bellevue. They don't have to worry that they're going to get a bill that they can't pay, that they're going to be treated as unwelcome, with all of the negative anti-immigrant spirit coming out of Washington. How great that that's not true in New York City. It's not true at Bellevue, and I'm so grateful to you, Mr. Mayor, to the City Council for always maintaining that. We are prepared at Bellevue. We are prepared at the other 10 acute care hospitals of Health and Hospitals. We are prepared at our other 60 outpatient sites. We have known for several weeks that it is likely that we would reach a point where there would be many people seeking our services because of respiratory disease. As the mayor has explained, 80% of people who contract this virus will have little or minimal symptoms, but 20% will need healthcare services, and probably about 5% of those people will need intensive services, such as a breathing tube and a ventilator machine. We are prepared for that. We have been practicing. Bellevue and all our acute care hospitals have plans. Now, those of you in the lay press may say, well, wait a minute, we've been hearing that hospitals are crowded, we've been hearing that ICUs are crowded already. How could you possibly be prepared to take on additional people? And the answer is that in an emergency, you change how you operate. You don't continue to operate in the same standard. So we are prepared at Bellevue and all of our hospitals that were we to have many patients with respiratory distress, We would rapidly discharge those patients who are in the hospital now and do not need to be in the hospital because they can be safely cared for at home. We would cancel all elective surgeries. So there is a lot of incredibly valuable work that a hospital like this does. We remove gallbladders, we fix hernias, we fix bones, we do arthroscopy, we do bariatric surgery, all very worthwhile. All that stops in an emergency. We have outpatient clinics. Health and Hospitals does 1.1 million outpatient visits a year. In an emergency, we will be canceling our outpatient surgeries, we will be canceling our outpatient visits, and we will be directing all our great physicians and nurses and technicians and physician assistants and nurse practitioners and pharmacists to our inpatient areas. We know where in every hospital, if we needed to set up intensive care beds. Someone thoughtfully asked the other day, well, but do you have enough intensive care bed? An intensive care bed is defined by the great nurse who is caring for the patient. It's not a physical space. If you give me a great nurse, as I have in Bellevue, I can turn any space into an intensive care space. What matters is the staffing. What matters is having the appropriate equipment. We have at Health and Hospitals 376 negative pressure rooms. If we needed to double up negative pressure rooms, not something we would ever do in regular practice, where the overwhelming likelihood is you'd have two patients with different diseases. Of course, they would not go in the negative pressure room together. In the case where we suddenly have many people who have tested positive for COVID-19, we would be able to double up existing spaces. We have practiced on our masks. We have practiced on our gowns. We know the different levels of protective equipment that are necessary. We have implemented that in all of our settings. We very much appreciate the efforts on having more testing. That would make a huge difference for us, and we greatly appreciate the efforts that you, Mr. Mayor, and the City Council have made to make that happen so that we know who is sick, who is not sick, and that will allow us to take care of people. We are 30,000 employees strong. We will all be taking care of those patients. If we have a large number, Mr. Mayor, Mr. President of the City Council, we are ready, we are prepared.
Thank you very, very much. Mitch, energetic report as always. Thank you very, very much. And now I want to thank again for his partnership and the great work he and all the members of the council are doing in spreading good information, helpful information, and helping to make sure that folks all over the city get to the help they need. Speaker Corey Johnson.
Thank you, Mr. Mayor. I want to thank, of course, your Deputy Mayor and Dr. Katz and Dr. Barbeau and Commissioner Criswell for everything they've been doing around the clock. As you have said, as the governor has said, this is a rapidly moving and evolving situation, and so I think it's important that we continue to give as much information as possible to New Yorkers on a daily basis so they know where things stand. As folks know, I decided to postpone my State of the City address, which was supposed to happen this Thursday, and I did that out of an abundance of caution. I didn't want to put anyone at risk. There were some advocates that were supposed to come that have some of the underlying health conditions that Dr. Barbeau and Dr. Katz have talked about over the last few days, and I didn't want to have a speech where people would be excluded, and so we decided to postpone that. But I think it's also important to reiterate that the health department right now, and you, Mr. Mayor, have not called for the cancellation or postponement of large-scale events in New York City right now, except for New Yorkers with those underlying health conditions, elderly people, folks that we have been talking about day after day that are at risk. And as the situation continues to evolve, my message to New Yorkers is to continue to tune in, continue to get the information that the state and the city are giving you on a day-to-day basis. If you have those symptoms, if you have a dry cough, if you have a fever, if you have shortness shortness of breath. We want to make sure that you get the care that you need, and the mayor updated the numbers. I also think it's important to acknowledge that people are anxious. People are concerned. It's what's being talked about on the local news and the papers, on the national news. We saw that the governor called in the National Guard in New Rochelle, and things like that understandably concern people. But I think it's important that even if you are concerned, even if you are a little fearful right now, that does not in any way stop you from doing the things that we have talked about day after day after day, which is washing your hands, using good hygiene, doing social distancing. If you're someone that needs to be doing that, taking those measures that we know will actually stop more people from getting sick. I just want to mention on the testing front that the mayor talked about, you know, we need more people, we need more tests. It's really, really important. At this point in their outbreak, South Korea was testing 10 to 15,000 people a day and had tested 100,000 people up to this point. We need a federal partner that's going to work with us, and we need the FDA to expedite the automated testing that the mayor just spoke about. It's really, really important. We saw that we got an initial tranche of test kits. We may at some point, and probably now, need the additional test kits so that when we ramp up that testing, that we have them, which is why it is so important that there is seamless coordination between the feds, the state, and the city. You've been seeing that collaboration from the mayor and his team and the governor and their teams, Dr. Barbeau and Dr. Zucker. You've been seeing that collaboration. We have seen at the national level, at the federal level, the president saying, I think, a lot of unhealthy, unhelpful, and untrue things. And so to get a real information, tune into the state and the city to make sure that you're getting this in a calm, even-mannered way that doesn't induce panic, but also doesn't downplay what we are dealing with right now. That is what is most important in the midst of what we are going through. Right now, as the mayor said, thousands of people are self-quarantined, which is a good thing. And the last thing that I want to mention, and I mentioned it yesterday, is that we are going to, and it is incumbent upon us as a city and the state, I don't know what the federal government is doing in this regard besides the emergency appropriations bill that they passed. We are having conversations about the budget. We are having conversations about, we're in the middle of preliminary budget hearings. The OMB, the Office of Management and Budget, is looking at this. The mayor can speak to that, but the council's paying attention to it as well. How is this potentially going to affect the revenue that comes into the city? What adjustments are we making? Are we doing additional investments in public health and in the other areas that we need? And we are having those conversations, and we'll be ready to make those adjustments together as we see fit. So I just want to end by saying, please take the precautions that you're hearing every single day. Wash your hands, look out for the symptoms, do the things that people are talking about, and lastly, imploring the people at the federal government to work with us to expedite this automated testing, to do what we need with a good federal partner. We need a real federal partner to help us through this crisis, and continue to pay attention to what the governor, the mayor, and their health commissioners continue to say every single day. Thank you, Mr. Mayor.
Thank you very much, Mr. Speaker. We'll do questions. I'm going to start on this side. Again, let me do my simple ground rule up front. I'll start on this side. I'll go to that side. Everyone, one round first for everyone, and then if there's anything real pertinent, we'll come back on. Go ahead.
Mr. Mayor, the city has told people to not wear masks because masks cannot protect you from being infected, only can prevent sick people from infecting other people. But at the same time, you said the medical personnel need N95, and you said one of the contention ways is like people sneezing to your face. So can you explain the rationale of not encouraging people?
I will start, and then our health professionals can go into more detail. One of the things that's clear about health personnel is they are constantly exposed to people. And the difference, I would say, from what we've seen so far, and again, everything, this is preliminary based on the knowledge we have of this disease from only weeks of everyone even knowing it existed and trying to constantly update our knowledge. But there's a real difference between the interaction that people, everyday people have with others versus when a health professional sees many, many patients in a day in much more intimate dynamics. So I think there's just a fundamental qualitative difference, but take it from there.
So it's incredibly
Is
important.
yours on? Yes, okay.
Yeah. It's important for us to first and foremost protect our healthcare workforce. And it is imperative that they have the equipment that is needed in order to ensure that when they are seeing patients that are potentially symptomatic with COVID-19, that they are protected. Because if we, as we anticipate, have more individuals diagnosed with COVID-19 and we have healthcare workers that are also affected, it then starts affecting the capacity of the healthcare system. And so that's why it is one of our central areas of focus. And then secondly, with regards to the utility of masks for everyday New Yorkers that are not symptomatic, the concern is that it provides a false sense of security, the most important and central way to minimize your risk, because, you know, we need to be realistic here. There is no zero risk situation unless you hermetically seal yourself in your apartment. The most effective way is to have diligent hand hygiene practice, which means washing your hands often, thoroughly, and if you're not close to a water source, to use alcohol-based hand sanitizer. And so for everyday New Yorkers, we don't recommend the use of masks, of surgical masks. The one situation where a mask would be useful is if someone is known to a healthcare provider to be coming in because they're ill, then we are recommending to healthcare workers that they meet that person outside of the office or as soon as they come into the office and place a mask on them so that they don't then infect other individuals.
Okay, yes.
The nurses and other frontline workers had a couple of questions about resources. One, beyond the N95 respirators, I think there was a concern that there could be, maybe not now, but there could be shortages of other PPE, gowns and the regular surgical masks, not the respirators, but the regular masks. So that was one question. Is that something that, do you share that concern that there could be shortages? Is that being addressed? And then the second one.
The surgical masks, we have a very, very large cachet and are not at all an issue, and the gowns the same. So those are not where, as the mayor has appropriately called for, it's in the N95 masks where we want to make sure that it's not that we have enough for today, but what the mayor and the speaker want to make sure is that we have enough to get us through September.
The other question was, is there a plan you can describe for offsetting nurses and other healthcare workers who have to quarantine?
Is there a plan? What? I couldn't hear that.
If nurses and other healthcare workers have to start quarantining, what's the plan to sort of address that sort of,
So I'll start and pass it. You know, again, that's a standard procedure. Some of that will happen inevitably. Remember that, you know, we're going to take a whole host of precautions to keep our healthcare workers safe to begin with. If some end up having a quarantine, that will happen, and then they'll come out of quarantine, maybe back in the game. And we're going to clearly work to make sure that there's sufficient personnel at all times, including by adjusting away from those less necessary procedures. Do you want to add anything?
I think you've said it well.
Okay, go ahead.
Yeah, Mayor, on the budget, I was wondering if you could say what your thinking is now about the potential adverse impact of the virus on the economy, and if you're contemplating budget cuts, anticipating maybe even a recession coming.
A couple of different things. I mean, the immediate thing we're looking at, working with the council, obviously, is relief for small business. We announced a couple of initiatives that will be added into the budget. We'll look to see if there's other things that we need to do. In terms of revenue forecasting, we will do that as part of the budget process, which culminates in the next 6 weeks or so. So we'll have a lot more information. The stock market dynamic is deeply troubling. This morning seemed to be a little bit better, obviously.
All right, we're going to switch from that news conference